Today, we are going to take a look at a BodyViz brain builder about human growth hormone and growth disorders, and then walk through a case study example. Robert Wadlow of Illinois died at just 22 years old. At 8 feet and 11 inches tall, he remains the tallest person in recorded medical history. What caused such extraordinary growth? Wadlow had a tumor in his pituitary gland that caused his body to produce excessive amounts of human growth hormone. In this brain builder, you'll learn what HGH is, how it works, and what happens when the body produces too much or too little of it. Human growth hormone is a protein hormone released by the anterior pituitary gland, a small endocrine gland at the base of the brain. HGH is essential for normal growth in childhood and plays an important role in metabolism and tissue maintenance throughout life. One of its most important functions is stimulating growth in long bones. HGH targets specialized cartilage cells called chondrocytes located in the epiphyseal growth plates at the ends of long bones. These cells multiply and secrete extracellular matrix, which becomes new bone tissue and allows bones to lengthen during childhood and adolescence. To understand more about how HGH works, it helps to see it as part of a chain. At the top, the hypothalamus acts as the control center, releasing two signals: growth hormone releasing hormone, or GHRH, which tells the pituitary to release HGH, and somatostatin, which tells it to stop. This gives the body a precise way to regulate how much HGH is in circulation at any given time. HGH is released in pulses from the pituitary gland and acts on the body in two ways. It directly targets tissues like the growth plates and bones, and it signals the liver to produce insulin-like growth factor, or IGF-1. IGF-1 then drives cell division, growth, and differentiation throughout the body, and helps feed back into the system to prevent unchecked growth. HGH production naturally declines with age. Lower levels of HGH are associated with reduced muscle mass, decreased bone density, and other physiological changes linked to aging. If too much HGH is produced before growth plates close, the result is gigantism. Children with gigantism grow extremely quickly and may reach extraordinary heights, similar to Robert Wadlow. If excess HGH production occurs after growth plates have fused, the condition is called acromegaly. Height does not increase, but bones and soft tissues grow thicker. This commonly affects the hands, feet, and face. Common signs of acromegaly include enlarged hands and feet, a larger or protruding jaw, joint pain, organ enlargement, and excessive sweating. Individuals with acromegaly caused by an HGH-secreting tumor may also experience headaches or vision problems if the tumor presses on nearby brain structures. HGH's muscle-building effects have also made it a target for misuse in sports, similar to anabolic steroids, but the risks are significant. Prolonged misuse can produce acromegaly-like symptoms: enlarged hands and feet, joint pain, and organ growth. Too much HGH is too much HGH, whether it comes from a tumor or a syringe. When the pituitary produces too little HGH during childhood, growth hormone deficiency may result in dwarfism. Growth progresses more slowly, and these individuals are significantly shorter than average, although their body proportions usually remain normal. Clinically, dwarfism is defined as an adult height of 4 feet 10 inches or less. In adults, low HGH levels may cause increased body fat, reduced muscle mass, low energy and stamina, and decreased bone density. Doctors often first notice a growth hormone problem during routine checkups, where a child's height is measured and plotted on a growth chart. Being below the 3rd percentile or above the 97th percentile may prompt testing. Because HGH is released in bursts, a single blood test isn't reliable. Instead, doctors measure IGF-1, a hormone made in the liver that reflects the overall HGH activity. They may also perform stimulation or suppression tests to see how the pituitary gland responds. If abnormal levels are suspected, imaging such as an MRI is used to examine the pituitary gland and hypothalamus for tumors or damage. A full medical and family history is also important. prior radiation treatment to the head is a known risk factor for pituitary dysfunction. Treatment ultimately depends on the cause. If a pituitary tumor is found, doctors monitor it with regular imaging. Growing tumors may be surgically removed. Children with growth hormone deficiency are treated with daily injections of synthetic HGH. The earlier treatment begins, the better the outcomes can be. Growth often improves within months, though therapy may continue for years. Adults with low HGH may also receive injections, carefully monitored to avoid side effects such as joint pain or swelling. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 13. Sex, male. Chief complaints? Parents are concerned with their son's short stature and fatigue. You invite the patient into your office for an examination. Your patient's mother explains that he has always been one of the smallest students in his class, but over the past 2 years, he seems to have fallen even further behind his peers in height. You measure his height, and he does fall below the 3rd percentile for his age. During the exam, you notice that he is not only shorter, but also appears younger than his age. He has reduced muscle tone and slightly increased body fat around his abdomen. Right away, you suspect there is a hormone imbalance at play, so you order blood tests to measure IGF-1 levels since HGH is released in bursts and can't be accurately measured with a single blood draw. The results show low IGF-1 levels, suggesting reduced HGH activity. To investigate further, you order an MRI of the pituitary gland. The imaging does not reveal a tumor, but shows a slightly underdeveloped anterior pituitary gland. Based on his slow growth, low IGF-1 levels, and imaging results, you diagnose the patient with growth hormone deficiency. Treatment begins with daily injections of synthetic HGH. Within several months, his growth rate increases. Over time, with careful monitoring and dose adjustments, he begins to move closer to a normal growth curve for his age. Regular follow-up appointments and blood tests are scheduled to ensure hormone levels remain balanced and treatment remains effective. This has been a classic example of a growth hormone deficiency. Thank you for watching this Brain Builder video. Please like and subscribe to our YouTube channel, and if you are new to BodyViz, check out our other anatomy resources and schedule a demo today at bodyviz.com.